It's 5 o'clock p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting updates on the latest coronavirus case numbers, as well as the vaccine campaign and details on the new restrictions in areas outside of the greater Seoul region. It's starting now. Let's listen in.
We will be providing sign language translation. First, we will hear from Minister Gov'T of Health and Welfare about the countermeasures against COVID-19. I am the first vice head of the Central Disaster and Safety Countermeasures Headquarters, Gov'T. Today's meeting was held by the President, and we had in-depth discussion about the countermeasures for the fourth wave. First, I will provide an update on the latest findings for the past week. On a daily average, there were 1,465 newly confirmed cases, and this was an 8.7% increase compared to the previous week. And for the metropolitan area, we saw a 2.4% decrease at 966, which was a decrease compared to the increase that we faced for 3 weeks. We believe that this is the effect of the epidemiology research and the strict measures that we had put in place for the past 3 weeks. However, it is not confirmed, and we still have to see. And for the non-metropolitan area, we were at around 490 people, which is a 40% increase, and the trend is growing. We're seeing the trend stabilizing in the metropolitan area. However, we're seeing a surge in the non-metropolitan area. And for the reproduction area as well, in these non-metropolitan areas, reproduction rate is at 1.27, which is showing this trend. And by regions, we are seeing an increase in the Daejeon, Chungnam, Busan, Gyeongnam, and Jeju Island, and we are seeing the numbers increasing, especially in these areas. And when we look at the path of infection for the non-metropolitan area, we are seeing that it is happening from singing rooms, entertainment facilities, bars, and other multi-use facilities, and we are seeing such a characteristic. And we are seeing a spread due to the Delta variant as well. And it was at 48% last week. It was at only in the 30s for the beginning of June. However, we are seeing that now almost half of our patients are infected with the Delta variant. In the metropolitan area, we're going to have the fourth step of social distancing measure for another 2 weeks. And for the non-metropolitan area, since we are seeing an increase in the surge, we need a stricter measure. We are seeing the movement decreasing in the metropolitan area. However, we are seeing this movement increasing in the non-metropolitan area. And there's also an increase in the use of the multi-use facility, which is quite risky. Therefore, based on the discussions that we had with experts, we're going to elevate the social distancing measure to level 3 in the non-metropolitan area for 2 weeks. And this will also apply that measure where we are forbidding any personal gatherings for 4 more people. And we're going to have 1 day of preparation, and we're going to start applying this since Tuesday. However, for the smaller cities and smaller guns where there are less than 100,000 people residing in, we're going to see how we're going to apply certain measures. And for the measures that apply the third step of the social distancing measure, the use of multi-use facilities will be limited to 10 p.m. and also there will be limited in the number of people who can attend weddings and funeral halls and events. And for the religious facilities, the number of participants are limited to 20%. And also for the vacation sites and also for resorts and etc., we're going to prevent any drinking or any events at night. And also we're going to apply any prevention in the gatherings, and also we're going to apply some measures for the operating hours of institutes such as the after-school institutes. Please refer to the press release document for any details. The government is strengthening the disease control measures and also strengthening our countermeasures. Last week, we have increased the number of screening facilities, and on a daily average, we had 250,000 cases of tests, and this was a great increase in just 4 weeks. And expecting that there would be a crowd, we had lengthened the operating hours so that we can make it more comfortable for people to visit. And we have also dispatched a lot of people who are working in these centers, and we are also enhancing our measures in terms of our administrative measures as well. And in the heat, a lot of people are helping out, and we want to express our gratitude to the personnel who have been helping us. And we are continuously securing hospital beds. Right now, we can use around 35% out of the 20,000 hospital beds that we have. And for the critically ill, we can still use 56% of the hospital beds, therefore we have room. And for the residential treatment centers, we still have enough capacity. And if we see an increase in the non-metropolitan area, then we will have to secure more hospital beds for the patients that may come up in the non-metropolitan area, and we have planned to secure more hospital beds. And also, we have come up with a new task force team in the Central Disaster Management Headquarters, and we're going to cooperate together with the local governments. And we're also going to make sure that there are no one waiting for the hospital beds so that before they get hospitalized. And the task force team will be monitoring many different sites such as cafes, restaurants, and the after-school institutes, and we have already found some cases of violations. And we have penalized those that have been found to have violations, and this number is amounting to about 1,000. And for 24 departments, we have done monitoring for many different facilities, and we are continuously going through with our crackdowns as well. And special monitoring will be carried out for restaurants, entertainment facilities, sports facilities, and etc. And for regions with less patients, we're going to dispatch them to the areas with a lot of patients. And we're also going to cooperate with many different areas. And especially for vacation sites, we're going to have special monitoring. And we're also going to strengthen our post management. And the Prime Minister's office is supporting any legal measures that might be required. The government, until we are stabilizing the situation, will be making sure to focus on our monitoring so that we can curb COVID-19 as soon as possible. Dear citizens, since July 7th, we have seen more than 1,000 newly cases on a daily average. And we do understand that a lot of people are probably tired and feeling hard. And it is very apologetic. I'm very apologetic that we have to elevate the social distancing measure to level 3 in the non-metropolitan area in such difficult times. However, this is inevitable. Therefore, we want to ask for the understanding of our citizens and also for cooperation. We're going to start vaccination for those in their 50s starting tomorrow, and we believe that once this is completed, the risk of COVID-19 will decrease. However, our fourth wave is especially infecting those in our neighborhoods and in our surroundings, and we are seeing silent infections, and therefore we have a lot of hidden patients as well. In order to curb this, we believe that we will need stronger efforts. In order to make sure that we can overcome this, we especially need the support of our citizens. Please refrain from going to any crowded and confined spaces. And for the summer vacation, we ask you to postpone it to September if possible. And if we can all work together, we believe that we'll be able to overcome this wave of COVID-19 as we have done well until now. The government will also be supportive so that we can be helpful as well. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.